if research, if research in biomedical area to be done, it should be intersectoral. So biomedical image processing, the theme you have chosen, is in fact the great topic which stands intersection between medicine, computer science, and engineering. This cannot be better. The concept that what you are discussing, most of the delegates when we talk about, uh, you want to cross beyond human limitations. That the process that we are looking for that. Your in biomedical image processing, what we look is data acquisition and data enhancement. Because most of the area is challenge our machines. Data enhancement probably one area that will go a long way in our predicting diagnosis. And I am sure that AI/ML, what are planning and deep learning, we feel our especially colleagues, they feel what we cannot see in a human eye by image enhancement, we could see that and we can predict that. That would be a big way to go. Saying so, we have got certain challenges. COVID taught us. COVID, all cases of COVID, we did a CT scan. After about first wave, second wave, we come to know there is a called GCC, that is a opacity, lens opacity, particular type of ground glass opacity, we say, and that can AI/ML can predict, and that is much more accurate than RT-PCR. So when say GCC is there, then we say before RT-PCR positive, we say is a case of COVID. So we are very thrilled and very happy about that. AI/ML can tell us, X-ray, CT scan can tell us diagnosis COVID better than that. But post-COVID, when you see GCC, that is not COVID. So these are certain interfaces of clinical correlation. Because that time pandemic, 99.9% cases GCC were COVID. When pandemic is over, that are not the case. So similarly, machine learning, deep learning, whatever we do it, it can predict, but some clinical correlation need to be done, which can give us the idea that what we are going to be in future. And at the end, I wish this type of event is extremely important because our university is focused not only intersectoral, inter-school, but also inter-university research. Like AIMS is there. Unless we go to a larger area, it's very difficult modern day in a healthcare research that you focus on a particular specific disease or something on that, you can get out. It's not easy. So this initiative I appreciate. Also, Satya, I think we should take it to the next high, and we want certain results out of that. At least it is the beginning. There is no doubt it's a beginning where people got access to you. They have got a problem statement, they talk to you, you try to bring out a solution. It's not possible to bring a solution every case, but at least one attempt should be done. Thank you very much. I will thank Satya for your endeavor and all delegates. Wish you happy learning. Thank you.
Thank you, sir, for your powerful and thought-provoking words. Your message will certainly inspire our students to pursue greater heights. I feel grateful to introduce Dr. Ashutosh Biswas, a distinguished professor of medicine over 30 years of experience at AIMS New Delhi and Executive Director AIMS Bhubaneswar and former Director and Vice Chancellor of the Indira Gandhi Institute of Medical Sciences, Patna. Dr. Biswas studied his postdoctorate at UCLA Los Angeles, USA. He also pursued fellowship in infectious diseases from Manchester University, UK. He was awarded fellowship for master's training in clinical research at the Albert Einstein College of Medicine, New York. He is an expert member of numerous national and international organizations such as the WHO CRO, Global Development Group GDG, ICMR, ISID, NCVBDC, NIMR, and MoHFW, Government of India. He has also authored more than 200 medical research articles published in esteemed national and international peer-reviewed medical journals. Sir, it is my privilege to invite you to share your valuable insights.
Thank you very much for your good words. and I am extremely happy to join in this meeting. And this is biomedical image processing and its applications. And I would like to thank and this really the important topic that nowadays that especially I would like to thank the organizer, Dr. Ashutosh Das, and the other distinguished here from the School of Computer Applications and the KIT, Dr. Beena Goswami, who is the Director General, and also Dr. Rama Chaudhary Ramachandra Das is the Dean and Principal of the KIMS, and also the registered here and other dignitaries, those who are on the line in this program. Especially, this is just being a medical man and the thinking about the image processing that we have been in this field to diagnose many diseases. Now, what is the process of diagnosing and then treatment, prediction, and prevention, and then also monitoring? So it is now going to be the practice of medicine is going to be a revolutionary change in future because of the implication of the CI. So we hope that in future we will have more accurate and more error-free practice of medicine and from the diagnosis and from the treatment and all. So I hope I'll be taking much time in my lecture after this, so I won't be able to now take much of time. So thank you very much once again for inviting me, and it's a great honor to be here today. Thank you.
Thank you so much, sir, for your insightful and inspiring words. I would now like to invite Professor Dr. Gyanaranjan Mohanty, sir, the esteemed registrar of KIIT deemed to be university, who is a distinguished academician and a visionary administrator whose dedication to fostering innovation and academic excellence has profoundly shaped the growth trajectory of our institution. Under his dynamic leadership, KIT has continued to evolve into a world class university known for its inclusive culture, research driven learning environment, and strong student centric ecosystem. His remarkable ability to blend academic integrity with modern educational practices has significantly influenced the university's progress and development. His guidance has inspired thousands of students and faculty members to strive for outstanding achievements, both nationally and internationally. We are truly honored to have such a leader of such stature among us today. Sir, I invite you to please say a few lines.
Thank you, dear Akanksha, for your kind words. So, namaskar to everyone present here. Our honorable chief guest of this inaugural ceremony for the inter school, Professor Dr. Ashutosh Biswas, esteemed director, AIMS Bhubaneswar. Our honorable dean and principal, KIMS, ABM Professor Dr. Ramachandra Das. Esteemed Director General, School of Computer Application, Professor Dr. Beena Goswami. Esteemed Dean and Coordinator of this winter school, Professor Satyaranjan Das. All the distinguished invited speakers, resource persons, esteemed medical practitioners, all my esteemed colleagues, the faculty member of School of Computer Application and other faculty member who are joined here. And my dear participants and students joined for this winter school. A very good morning to each one of you present here online. On behalf of KIT University and on behalf of our honorable founder, KIT and KIS, Professor Dr. Achyut Samant, it is a great honor and pleasure for me to welcome all the esteemed members, all the participants, especially our honorable chief guest of this winter school inaugural ceremony. So I welcome all of you to this inaugural ceremony of the winter school on biomedical image processing and its applications, which is jointly organized by our School of Computer Application and our Kalinga Institute of Medical Sciences of KIT University. I wish to congratulate both the school and head of the school, because this is first of its kind. Both the School of Computer Application and our medical school both joined together organizing this winter school in an interdisciplinary area. Because I can say it is a valuable academic initiative that brings together computer science, artificial intelligence, machine learning, and medical science on a common platform. So they have chosen, that's why I'm happy that here also in inaugural ceremony, both our Dean and Principal Kims as well as the Director Ames, both from medical background, and here DG Computer Application and me, we are from computer background. So he also chosen the guest for this inaugural ceremony in that. So thanks to the organizer for choosing this interdisciplinary area. We all know that biomedical image processing is a fast growing, highly important field, because medical images, just now our Professor Ashutosh mentioned why it is important, and during the COVID also he mentioned some points, right? Because medical images such as X-rays, CT scans, MRI, ultrasound images play crucial role in disease detection, diagnosis, and treatment planning. And by using this image processing, machine learning, and deep learning technique, actually, we can support doctors in making faster, more accurate, as mentioned by Professor Biswas, that error-free diagnosis and a reliable clinical decisions, I can say. So applications of this field include early cancer detection, brain imaging, cardiac analysis, surgical planning, and ... So many things are there, making it extremely relevant to modern healthcare. So the main objective of this winter school is to help or support the participants understand the key challenges, or I can say research challenges in biomedical image analysis, while connecting the theoretical knowledge with real world medical practice. And I'm sure during this 8 days of program, participants will learn how to analyze, how to pre-process and interpret these medical images using machine learning and deep learning techniques with hands-on experience, as you mentioned, that with hands-on experience using real data sets or any clinical data sets available. And through interaction with medical experts, as I mentioned, there are medical experts are there. They'll also gain an understanding of clinical needs and ethical responsibilities of the, and I can say, and the development of AI and ML solution that are both scientifically sound and I can say clinically meaningful also. And as I learned from Professor Das in his introductory speech, that this winter school is enriched by high quality invited talk from 10 eminent researchers in image processing and AI from academia. All are from also outside India. And I can say that their global research experience will expose participants to the international trends and inspire some new ideas. We are also privileged to have 13 medical practitioners from various specialized domains, from various institutes, as he mentioned, from AIMS, from KIT, from various institutes. I'm sure they will share this real-world clinical insights and strengthen the link between the technology and uh, medicine. I would like to express our pride in being part of KIT deemed to be university, an institution known for academic excellence, innovation, and social commitment. Under the visionary leadership of our honorable founder, KIT Skins, Professor Dr. Achu Samant, KIT has grown into a globally recognized university which promotes interdisciplinary learning, research, and inclusive education. Because his vision and dedication continue to inspire not only all of us here, but also to millions and millions of people worldwide. I sincerely thank the coordinator of this winter school, Professor Satyaranjan Das, and both head of the school of our KIMS and School of Computer Application, Professor R.C. Das and Professor Veena Goswami, all the esteemed faculty member of School of Computer Application and KIMS for their hard work and commitment in making this winter school possible. And as he said, this is a first step. We continue maybe next summer school in the June. He will start or he will continue this one to a summer school with advanced learning. And I'm sure their efforts have created a meaningful learning platform for our students, for the researchers, and as well as also for the professionals. As he mentioned also, Professor Das, the professionals, he has mentioned also one name also, that professionals also present here. Dear participants, I agree with Professor Das that don't be join only for the certificates. I encourage you all to be actively participate or actively take part in the session and interact with the experts, ask questions, and make most of the learning opportunities. Because in this hybrid mode, or I can say online mode, maximum time we have seen or we have observed, only you switch on the video and then you will do your work, and then the expert will continue his or her session. But please take it seriously. If you are participating, then take it seriously, because you see the background of those experts. The director Ames himself is an expert. He is going to give talk. So how much busy he is, or how much busy all those research person, you must know. You must feel that. This so much busy, but still they are sparing their time to educate you all. They want that our community or the people or the student or the researchers should know all those things. So that's why when they are sparing their time. My request, my honest request to all of you, as you are joining, please give your time and make most of the session. And with these words, I once again warmly welcome all of you and wish this winter school on biomedical image processing and its application a great success, and also look forward to join again in the summer school on the same topic, advanced topics on biomedical image processing and its application. So thank you and wish you all a wonderful learning experience. So thank you.
Thank you, sir, for your kind words and motivation. Ladies and gentlemen, as we approach the close of this inauguration session, it is my honor to propose the vote of thanks. On behalf of the organizing committee, the School of Computer Applications, and KIIT deemed to be university, I express my heartfelt gratitude to all our distinguished dignitaries for sparing their valuable time and honoring us with their presence and insights. We would like to extend our sincere thanks to Dr. Satya Ranjan Das, Dr. Veena Goswami, Director General SCA, AVM Dr. Professor Ramachandra Das, Dean and Principal KIMS, Dr. Professor Ashutosh Biswas, Director AIMS Bhubaneswar, and Dr. Gyanaranjan Mohanty for illuminating today's event with knowledge, inspiration, and vision.
My special thanks to all the faculty members, staff, and student coordinators for their dedication and meticulous efforts behind the scenes. And finally, a warm appreciation to all our enthusiastic audience and participants whose energy and engagement made this gathering meaningful. Thank you all once again. We look forward to many more such opportunities of learning and collaboration. Have a wonderful day of learning ahead.
Thank you, Akanksha, and thanks
Thank
to
you.
all the dignitaries. So now we have a session of Dr. Ashutosh Biswas. So he is going to tell about the topic of role of AI in cardiovascular diseases. I think, sir, we can start now. So the inaugural session is over. So if you want, you can stay for the session of the Ashutosh Biswas. Thank you, sir.
Thank you very much, Dr. Das. It's my great pleasure to be here today to take this session and to take part in a very important topic, the biomedical image processing. So I'd like to share my slides, a few slides that I have made. Just give me a moment.
Yes, sir, it's visible.
Can you see my slides?
Yes, sir. Yes, sir.
So good morning to all of you. This is just, I'll be focusing on mostly the AI and cardiovascular diseases. So now we are talking about AI in many forums. And then I have just made a very exclusive area that how AI application is going to help in the cardiovascular disease in terms of predicting the disease and prevention, diagnosis, therapeutic and prognosis. Nowadays, how we are in current situation, our human intelligence, where it fails, and then we are going to, I think, apply our artificial intelligences to make your more to strengthen your clinical intelligence. So this is important by using artificial intelligence. Now, how we are practicing in medicine, what are the goals? The prediction of disease is very important. And at this moment, what do we have any tools to predict the disease prediction model? So that, like a weather forecast, that we can tell that after a few days that we are going to have rain or storm. So can you have any data to process or image to process to predict that yes, after a few days or months, you are going to have a cancer, you are going to have heart attack or stroke or diabetic hypertension or anything. So that is that we are going to look for it, how this AI application is going to help to predict the disease much before the people are suffering from. So that is the important, so that we can have a preventive strategies. So to prevent those events to happen, to prevent the death, and sudden cardiac attack or cardiac complications that we have. So do we have any signal or any kind of risk factors that could be identified much before the disease that we have or the disease occurrence? So that is a very important. Now, preventive medicine is very important. How this AI is going to strengthen our prevention of the diseases. If you can prevent a lot of this severe complication that we have during attack, and prevention of the cancer also many ways. Now, diagnosis. How this AI is going to diagnose the disease at the earliest stage. The earliest stage diagnosis, early diagnosis of cancer is the answer for the cancer. Now, we can have the treatment totally and cure the cancer if it is very diagnosed early, or maybe we can diagnose much before happening the diabetic. Now, can we have any tools to say that yes, after 10 years or 5 years, you are going to suffer from diabetic, hypertension, or so many other diseases? Yes, we can. We can process many things. A robust data by analyzing your genes, genetic diseases can be expressed much, maybe after 10 years or 20 years or 30 years from the birth. So by analyzing the data and process various biomarkers so that we can predict much more before the disease happening very serious. And then in the treatment part, nowadays, what treatment we are giving is there any variations of the treatment from doctors to doctor? Do we have any better doctor, good doctors, or this is the best doctors? How it varies? Why it will be varies if the treatment, the diagnosis is one and treatment is maybe it may differ from doctors to doctor, and people they look for a best doctor because they don't want to play with their own life and trial and so many things. So therapeutic implication, can it be strengthened by the application of AI, and how it could be? Yes, that is what. And also prognosis. Now, if we have started a one treatment protocol, now he is going to how much improvement will be there with this current treatment protocol. So is this application of the AI that is going to tell us yes, there will be 90% prognosis, the improvement, and 10% will be death or mortality in this protocol. And how we are going to predict this in future that yes, he is going to have 100% recovery. So this is now the area of implication of AI. And now here, I'm just showing this is in future. The robot doc is going to be there in future to each and every human being. Now, trust is a very important, whether the society and community is going to trust on AI-based diagnosis. Although it's going to have a create create our faith and believe in the community. It is very Herculean job because the accuracy is the very important thing. So the cardiologist, if the AI, definitely by processing the image processing, maybe sound processing, and maybe different other motion processing. So by processing through different points, so now finally, though applying this AI, likely to give a diagnosis on cardiovascular disease or neurological disease or gastroenterology department, GI surgeon, chest specialist, neurologist. So because this is a vast area, AI, and somebody has to work on very exclusively in a different domain, as we have a different specialties, super specialties. So probably this area, image processing, or maybe artificial intelligence, other domain, sound processing, how we are diagnosing at this moment. Excuse me. So our image processing is a very important phenomenon. When we see by our own eyes, see what we see. We see a patient, how patient is coming, walking, and talking, various observations by our eyes. That is the image. And we learn that if the patient is standing like this, walking like this is the diagnosis. So neurological problem, the patient will have different gaits. And if these gaits, very exclusive gait, oh, this is the lesion and this is the neurological problem of this patient. So like that, we are giving training to our brain. And then we can see and diagnose, yes, this is the... So during our course of our medical education curriculum, so we have been trained and educated, and our brain is becoming intelligent to diagnose in that way. And we see also various CT scan, MRI, ECG, and different image process in the biomedical field. So by seeing this, if I see an CT scan, now this is, we have been taught if the signs are there, then this is the tumor. And what type of tumor also we can see the small signs, different signs and symptoms correlate, and then we give the diagnosis. This is how the process. These images are being recognized by our brain, and then it is processed in our brain, and then we diagnose, oh, this has been taught in my class by this professor, that this signs, if it is there, so diagnosis is this. So this image and recognitions and processing and then diagnosis. This is what at the natural pathway, the natural intelligence in the medical field works. Now, in which field we are going to apply the artificial intelligence? Now, what we see actually by the eyes, the CT scan, MRI, ECG, and there are several other histopathological through the microscope to diagnose cancer. Now, through our naked eyes that we see, there is a limitations. Actually, we cannot go beyond our human limit. We have to understand that yes, our intelligence is not very robust because the data is so much coming to collect and then process to get the best diagnosis. So the human error still are existing in the medical field. So this error, how we can minimize the gap in the this diagnosis by the human intelligence, and then application of the AI definitely is going to minimize the gaps of the error that we have at this moment in medical practice. So this is what we are, our human eyes to understand the brain, to understand the image processing. So how this AI tools is going to read the CT scan to diagnose various diseases in the lungs or in the bones or in the heart or the brain, and also the image processing in the cardiological disease, neurological disease, like a EEG, now that process, the image process, and cardiological ECG go, and different image are generated for diagnosing at this moment by human intelligence. Now, by applying into this, now it's coming up that yes, this tool is very robust, and then can diagnose more accurately, and then also we can compute them, process them various ways to predict the diseases, prediction, and also future progression of the disease by taking various parameters into it to process. So this is what at this moment, I think this is just a future. I think this is the way human, maybe if someone is suffering from kidney disease, so the AI of the from the kidney, that is how the nephrologist or robot doc is going to look into the data. And now we are talking about the precision medicine or individualized medicine. Precision medicine is that, if someone is suffering from one disease and now that treatment may not be really generalized to everyone, because there are many factors we have seen that this medicine may not work equally, which has been very successfully seen that other patients did and this patient may not. So there is a difference of response in the same treatment. And why? What are the factors? Why this happens? So the sensitivity, resistance of the same medical we have seen may be due to several factors in our body. There are many parameters in our body responsible for sensitivity of same drugs, same protocol. Somebody is responding 100%, somebody may respond 50%. So what are the factors that we assume at this moment that our biological barrier markers are there, and also including the genetic markers, the response to that treatment, your immune system, various factors works. So by computing those, everything, probably we can predict that this medicine is going to work for you or not. That is called the precision medicine, by analyzing the genomics, proteomics, and various other biological markers in your body. And then you will be given a best treatment protocol. This is what it is only possible by analyzing the AI. So we are heading for that, but it's a robust data processing, and that in future will be, I think this is the way to minimize the error, reactions, resistance, and so many other things to respond. Now, why AI in cardiovascular care? So if I go for it, just I'm focusing in one area to understand so that it could be generalized for other, as I said, the kidney, liver, maybe brain, for other so many organs in your body. Now, why cardiovascular? Why? Because this leading cause of death in our in the world, and there are many ways why a lot of people are dying before actually is causing. So, is there any ways that we can prevent cardiovascular death by applying the AI, and which way that the rising load of this cardiovascular mortality could be reduced. So this is what the need for early detection is very important. If you could detect that, yes, this patient is going to have heart attack after maybe, if you can diagnose 2 years before or 3 years before, all the heart attack is a very sudden. Within 1 minute, the patient may die, and you may not have any scope to take the patient to the hospital or any medication. So it's a very sudden kind of thing. So now, is there any way that we can predict this kind of heart attack much before the patient will have this sudden cardiac death or any sudden cardiac complications? So yes, there are various ways we can, because now image processing, by knowing the coronary artery and its flow, blockage, and arterial wall thickness, the elasticity, calcium score, and various other ways we can really predict much before the cardiac attack. So it's a computing the various image processing. Then we can also assess that yes, this is really a coronary is under threat or risk for getting your blockage or cardiac attack in future about this. So we can understand at least. So if any patient may come for a regular checkup before they can have. And who are the people coming for cardiac assessment or screening for diagnosing the risk of having cardiac attack? Naturally, it is the elderly people. And then to precisely to understand the individual patient is under risk and various other parameters that to look into. This is what the people worldwide, more than 17 million people, cardiovascular disease every year dying. So this is the load and burden, and the cost is also there because the people are having this cardiovascular complication now. The cardiac disease treatment is little bit costly. So was any way that we can reduce the cost of the treatment by applying this AI? So diagnosing complications and the treatment. So through to understanding various ways. So how we can do it? So to know the status of the heart. So what are the image processing that we can generate to understand different cardiac diseases? The cardiac diseases are mostly due to muscular disease, electrical disturbances. As we know, heart is run by the electricity. That is our electricity, the electrical, if there is any electrical disturbances, so naturally heart pump and arrhythmia and other things going to cause the serious effects. So we have a ECG, different electrical activities of the heart through which we can know, and vascular supply, angiography that we know, from the echo imaging we can know the condition of the muscles, condition of the various structures, and also CT, MRI, and all that. So these are the image processing. Now, through that image, how really we can compute at the different stages, from the healthy stages, and then going for a full-blown disease of the heart, identification very early stage. So these are all, I think, is a with the computer applications and machine learning. So we have to, I think, design it that way. A lot of people are working across the world in this fashion, that ECG, and then predicting various ways that it can have different pattern of ECG to give you the diagnosis, and then echo and CT scan, MRI, coronary angiography, and all that. So now the question is, at this moment, we just look at the CT, look at the ECG, and then humanly we are giving the diagnosis by the brain, and the robust data that we need now to compute and to give a very accurate diagnosis, then probably you need to have this machine learning process. So now the public health and now gap is a very important gap between the public, our rural and urban healthcare sector. So there is a huge gap of the providing the services of the any kind of service, like not only the cardiology or public health challenge. In the urban and the rural people, there is not much of the hospital or doctors or specialists. They have to come to the city and the capital for getting the treatment, even for simple thing. So can you have, by using this, how we can really improve this health challenges, the gap that existing. So through the telemedicine and this image processing data, if you can process the data from rural to urban and where the doctors are sitting and giving the advice, diagnosis, and probably the treatment will be accessible by this rural public, and this will be a very help for the society community. So this, I hope, with AI, the telemedicine, or maybe the through the different mechanisms, or the mobile apps. There are many now apps coming, and image processing. The Android phone may be used by camera, can be used, and that may be image may be processed for diagnosing early diagnosis of the oral cancers. There are many people are applying for oral cancer or any kind of skin lesions by image processing. So dermatologist or skin specialist not available. Now take a photograph of the skin and the AI can give you the rough diagnosis and maybe that diagnosis may be certified by someone of the specialist and then maybe you can. So ethical issues are there, not that, but it will definitely educate the people before it's applied application of the medicine or any therapy. This then it would give a definitely guide the people where to go and who is the perfect person to be shown the specialist and it will channelize. So the various domains are there to really answer to this medical healthcare system. And there are many other ways also that impact on the families and communities. How this AI, the trust, probably do have a trust of this AI-based diagnosis, AI application, and giving the diagnosis. How much so? This is going to be, and also ethical issues are there, legal issues are also still we have to consider about this. So early detection and diagnosis is very important. And this is what, through normal image processing and then early diagnosis, sometimes we cannot pick up the early diagnosis. This is very difficult. So with the AI-powered imaging, the machine learning probably it can help us to diagnose even at the cellular level or at a very micro level to give the diagnosis where human eye can fail. The naked eye cannot have very accurate diagnosis. So nowadays various tools have come. The AI is used for diagnosing the lung diseases, and it has been tested in COVID also, pneumonia and all AI applications. So like that, your this image by processing the image, probably various images of the heart can also predict and identify the risk, that how much risk. The risk assessment will be more accurate, more probably robust. And by that, you can also predict and analyze the future disease of the heart. And therefore, the treatment protocol may be planned as a personalized treatment. So there are many ways. That is what the remote monitoring and telemedicine will be very helpful with which will be connected with the wearable devices. Now, the devices will give the signal to the doctors and servers where the hospital is established. So that the doctor immediately will, and the hospital will be warned by this wearable machine, the tools, and then immediately will be informed about the plan of treatment and management. That is telehealth platform. So, and the robotic assisted, as I said, the cardiac surgery now is all kind of surgery through the robot, and the robotic assisted robotic surgeries are coming, and where it is people are getting surgeons getting very helpful for more better outcome with the application of the AI as a robotic surgeon. And also it can be is used by the lifestyle behavioral intervention, various ways. So that is also one applications. And there are many innovations in the cardiac care that I have given these all ideas how we could really improve and predict various diseases and also know the prognosis and treatment, how the treatment outcome could be maybe more powerful to assess and streamline the care of the different cardiac diseases, and also could be monitored from the remote places by processing the various images through telemedicine, and also it can be accelerated by the many drugs discovery. So monitoring will be very helpful because image transmission may be very easy if you have various cardiological data could be transferred. Even the ICU could be managed by processing various ventilatory data. And the doctors who is cardiologist is in foreign or in USA, UK through this monitor, and he can also manage the ICU patient from far through this image data processing. So this is all about this. There are various domain now to really address the cardiovascular diseases. As I said, the predicting ECG analysis, diagnosis, imaging from your CT scan, MRI, and then your ultrasound, and there are different biomarkers also to predict, to compute for model and also know is risk in future technology, wearable technology, and personalized risk profile. The screening program is also very important to this AI. At least people will first screen and then the people will contact with the doctors, concerned doctor. So it will help very much in the community as screening tools and send the emails to the doctors, and the doctor will be able to diagnose and detect the heart failure or heart any other complications, so many. So this is how I think the promising area where we are heading, and I think through this image process, we will be able to take a very perfect clinical decision to support the human being and to minimize the risk in the various diseases. So these are all the flow, how we could really help in a different domain. And this is the clinical decision support. So this AI application, so image processing is going to improve where this artificial intelligence is going to improve your clinical intelligence and is going to strengthen your accurate diagnosis. It's not going to replace the physician or any doctors or any healthcare workers. It's going to support and strengthen our system of clinical medicine, practice of medicine. So this is finally the clinical decision support system, how it is integrated and different ways that this is the, I think, flow, how we are going to manage at this moment. We are having a lot of project AI and our from a different domain, how it could really help in this. However, but the challenges are much more by adopting the AI. So the validation, reliability, and then integration into this existing system, and faith and belief and trust. So how we are going to integrate with the community and to create faith on this ethical issues, privacy concern, because data, how the data is, all the data are to be kept confidential, and cost also, we have to know how much resource allocations and acceptance and the trust is also very important. So thank you very much for the kind patience hearing. Over to you, sir, Dr. Satya.
Thank you very much, sir. So I think if you have any questions, then you can ask. I think Dr. BG Punapa having some question, he raised the hand. Yes, one or two questions sir can take, because sir will go, many works are there. Yes, one by one just. Yes, Vivek. Yes, Vivek.
Good morning, sir. Good morning, sir. So I have a question. So from a clinical practice perspective, which application of AI, early detection, risk prediction, or remote monitoring has shown the most real-world impact so far in the cardiovascular disease management? Being a CSE student, I want to know about it so that I can implement it.
Yes, you are asking for a prediction.
Yes, sir.
Yeah.
So like, yes, sir.
Yeah, so prediction at this moment, no, we have what are the image processing? Images are there for cardiovascular disease to diagnose and to treat. So currently we have the system with the CT scan, MRI, angiography, ECG, and echo. These are the 5 common images that we create to diagnose, whether to know the current problem of the heart. So, but these are all not predicting the diseases. So, how we are going to predict through the ECG also at the very earliest stage we can have diagnose something. So ECG, by computing ECG, a normal ECG, and then you can have a different heart attack or maybe electrical disturbances. Those are all sometimes can give a very minute signal much before. So if you can really pick up those at the earliest stage, probably can prevent many diseases. And also from the echo imaging process, like valvular heart disease, myocardial heart disease, congenital heart disease, various diseases. So from that also by processing echo, and angiography is a very important component also to look for the coronary flow, and also sometimes the calcium score of the artery that gives you very much because it's calcification and the blockage of the coronary artery. So the score gives you the prediction that how much 60%, 30%, 20%, and then various ways. So now we are it is being developed, but further we are expecting that much more accurate model in the prediction model could be developed so that we can predict much before of 10 years, 15. At this moment, we can predict really when the already 20% block or 10% block, so we can see the block. But we cannot predict that when there is no block. We cannot say after 3 years whether you will have a block or not. So for that to predict, we need to understand the coronary artery wall, its cellular level, and its integrity of the intima medial thickness, and also its different layer of the muscles. So that is what I think. If you compute those, and it's still not there anywhere, these are all my innovative thoughts. These are all we are looking for it to to understand at the machine level, learning to magnify the arterial wall and see the structure when they are normal or very early stage, before 5 years or maybe 10 years that we can understand. Because heart attack is not a sudden. Then if it is not electrical disturbances, if due to coronary block, it's a slow process. It takes long time to develop and then heart attack. So this is how at this moment we are trying to know. So this model are there, but not much very promising at this moment. I think Vivek, you have understood and got
Yes,
my.
sir. Yes, sir. Thank you, sir. So I'm also working on a project which is on that.
Yeah, we are
Only I
working
have
on
made a
the
chatbot,
we
medical
are
chatbot.
working on the ECG at this moment. Various ECG as the normal ECG and abnormal ECG at the various stages, the myocardial disease, electrical disturbances, all. So this two ways to understand, and then probably if we can for radionuclide scanning to understand various wall motion abnormality of the various normal and abnormal patient. Various radioisotopes are given to understand the function of the cardiac muscle, each and every cell wall, and from there you can also predict. So these are all innovative model. Now we are thinking to go ahead, but there, as of now, there is nowhere in the world that you can. They are by using this technique that can predict much before the cardiac event.
Yes, sir. Yes.
Thank you, Vivek.
Okay,
So,
sir.
Yatharth, just ask
Thank you,
question
sir.
quickly.
Yes, sir. Good morning, sir. What I
Good
wanted to
morning.
ask is that since cardiovascular health and like cardiovascular issues, these issues are linked across multiple different domains. It can be caused by autoimmune disorders, it can be caused by kidney disorders indirectly. And what I wanted to ask is that the healthcare industry, not just in India, but everywhere, it is very segmented in the sense that there is not a seamless flow of data from one specialist to another. And a lot of people find it very difficult to actually there is loss of data and there is loss of information when I go from one specialist to another specialist, because the health uh, scene is spanning from different sectors. So, my question was that, do you think things like agentic AI and these different data science and agentic AI aspects, they can be used to link these? And what roles can hospitals themselves take to accept this in their pipeline? Because another like short question is that we know that hospitals are they need to be very sure that things work. They cannot just adopt a certain agentic AI or adopt a certain AI pipeline. So how can hospitals themselves streamline this process of accepting this technology? Thank you.
See now, what you are talking about the kidney problem, and there are several other problems. SLE or autoimmune disease can affect the heart. Now, definitely there are so many comorbid conditions: the hypertension, diabetic, obesity, dyselectrolytemia, their cholesterol, no, dyslipidemia, and there are several other factors are also responsible for causing the cardiac diseases in various ways. That we know. And if somebody is heart, the diabetic, now we know there is a cardiomyopathy is likely to be having complications after a few years, maybe 7 years or 10 years. That is already well known. Now, whatever may be, whether you can prevent it or not, if you know the risk factor, naturally we are preventing if it is known. But sometimes the problem is that it is affecting the heart. Now, in which way? If you can diagnose that early stage of whatever may be the risk factor. But problem is that most of the time the people are coming with our disease to our hospital, and we get the diseased images. Now, computing that, so if you want to develop a model of prediction model, you need to reach to the community, healthy people, and you have to start from there, and then you can predict this. So at this moment, the risk factor identifications of the various disease comorbidities are very important, and then computing them also will help us to predict the cardiac event. So and now when it is going to have, so it's a robust data that we need to analyze before you get the answer. So this is what we need: much more data processing and then model, and then probably in future we can answer accurately in which different diseases, different conditions that you are going to have cardiac disease. So am I clear to you, or anything else
Yes,
you
sir.
want? Right, thank
So
you.
another
Thank you,
one
sir.
question sir can take, because sir is busy in his job. So Arka,
Yes.
you just ask the question. Otherwise, question will going on because many queries are there. So you can
No,
take.
no, it's okay.
Good morning,
Okay.
sir.
Arka Banerjee is also there raising hands.
Yes, yes.
Arka Banerjee.
Oh, okay.
Yeah.
Quickly, you three ask the question in short way. Fine.
Good
Sir.
morning, sir. So I wanted to ask you, what are your ideas regarding like how AI can impact prognosis specifically?
Yes, prognostic markers. See, if someone is having now, suppose heart attack, now whether he is going to survive or he is going to die, that is the prognosis. So now, now how AI can help? At this moment, also doctor can tell, and when we are asking to the doctor, sir, he is going to die or he is going to survive, or ये कब ठीक होंगे, कितना दिन लगेंगे, ये तो no common questions they ask always, no. So we have to answer. Now, to answer this, what are the severity of the attack or event you have to analyze? The risk assessment, severity assessment. If the more severe, then less prognosis, less your outcome, not good outcome. So by analyzing the risk and its severity assessment, probably it can tell you the diagnosis. So severity of various diseases. If the coronary artery block, now whether 90%, 80%. So that will be the one component for predicting your prognosis. Then your score, calcium score. Maybe you are if a multi coronary or single coronary block or one block. So and the age factor, maybe other conditions, diabetic or age group. So you need to compute various factors to predict the disease outcome. It is not only one, right? So if the score is very high now, outcome will be gloomy and prognosis may be bad. That is how we predict and assess the prognosis. Am I right? Have
Yes,
you
sir.
got the point or Kabanarji?
Yes, sir. Yes, sir. Thank you, sir.
Okay, Kusagra, quickly just ask the question. Kusagra and
Yes.
Sylvia.
Good morning, sir. I wanted to understand, sir, how doctors usually verify AI predictions before making clinical decisions. Like whether doctors rely only on clinical guidance or do they their own secondary test or with their own expertise they confirm the AI outputs.
At this moment, what happens? If I am a cardiologist, now my knowledge, my intelligence that I have gathered over my experience and from the book and all, and my diagnosis, I am confident that I am 100% right. That should not be any doubt. If there is any doubt, then I have to learn and then I have to go. Now, at this moment, the cardiologist has to certify, yes, you are having this AMI, and before you initiate the treatment. The AI diagnosis and then initiation of the treatment cannot be. Somebody has to be there, authentic person to validate the AI diagnosis. AI at this moment is going to help the clinicians, the specialists, to understand better. And if anything wrong going on in the diagnosis of the doctors, cardiologist, neurologist, anything, then you can learn from the AI generated diagnosis. So because human error is likely to happen, not maybe very large, but yes, 1-2%, also very important, significant for one life. So this AI is going to, I think, teach the very specific way to the doctors, to the specialist, that this is what the diagnosis. Now, it will have a cross check that somebody is really, that if the AI gives one diagnosis and you are having another diagnosis, then why there are two? So the doctor will check again whether he is wrong or AI is wrong. So it's going to strengthen the clinical intelligence. It's not that entirely that AI is to be taken and the treatment will be started. Some doctors has to certify and then treatment. Kushagra, I hope you got it.
Yes, sir. That clarifies it. Thank you, sir.
Thank you. Sinjoy, last question. Sinjoy Rai. Yeah.
Good morning, sir. Sir, actually, I am a data analytics student. So I wanted to ask, how can AI models like graph neural networks bring together cardiovascular imaging and single cell and spatial awareness data, and so that we can understand tissue changes and guide patient-specific surgical plannings like a robot assistant?
I could not hear you. The voice is not clear. Can you repeat it again, please?
Sir, I wanted to know how AI models like graph neural networks, they can bring together the cardiovascular imaging with like single cell and spatial awareness data, understand the tissue changes that go on, and while having patient-specific surgical plannings.
Patient specific? I still am not clear. You are asking, can you be a little bit louder? Hello?
Sinjoy, repeat the question.
Patient-specific surgery. Sorry for the noise, sir. Actually, I'm traveling right now.
Okay,
So exactly what you want? Can you just in one
repeat
line
the
or two
question or in chat box you can write. Sinjoy, they're not
Yes,
getting
sir.
the question. Yeah.
No, you can, she can, I think, tell in short what exactly she wants. The surgical, I heard that some surgical assistance by the
Sir,
AI
actually, I
or
was asking how can we fit in AI models like
yeah.
graph neural networks with cardiovascular imaging and understand patient-specific surgical plannings.
Yes, surgical planning, yes. Now see, it is if what are the surgery you are going to have. It's not that one model is going to tell you that this is the indication for surgery. Now there are valve replacement surgery or maybe coronary bypass grafting. So if we think of the replacement of the valve, now mitral valve, aortic valve, there are many surgical intervention. Now we have to this understand the function of one valve and then indication of the valve replacement and then indication of valve replacement when it is not working to maybe 80% or 70%. And then how we'll assess that this valve is not working, only working 20 or 30%. That risk assessment by your AI. Now, how this AI is going to tell that yes, this valve is going to is working at this moment 30 and then needs replacement. It is through AI of image processing of the echo. That is one, or maybe the CT scan that you have to focus on the heart valves and heart valve thickness. So there are few your parameters are there which we can feed to your machine learning. That yes, these are the parameters that when we have this is the indication for your valve replacement. So machine, how machine will learn? When you train the machine, then only machine will tell the same thing. So this training the machine learning, this is from the data, and we have to feed the data, and then whose data is processed, and then probably we'll get the answer. So different functions of the different. If suppose patient is requiring bypass surgery, now the coronary vessels whether block or not, so data to be fed from the coronary angiography. So that process will tell, okay, this is now this place will be replaced or stenting, or so this is how AI is going to help. I hope you got it.
Yes, sir. Thank you, sir.
Okay.
Okay, so last question from Mainak sir. Yes, Mainak sir, you can ask.
Sir, actually, my question is about initiative. Sir, if we see reputed journals like Mayo Journal and other biomedical and other journals, in foreign, there you can see the authors are actually both engineers and doctors. But
Yes.
such thing we may not see when in India we are doing this thing. So how we can initiate this collaboration between doctors and engineers, especially those who are working in AI ML area, so that we can have more credible papers or more credible research.
Yeah, yes, this is a very important point that Moinak you have raised. This is now a time to sit together the medical and engineering domain, because at this moment we do not understand and there is a huge gap in the interface between the medical and engineering. And that is the reason probably we are lacking behind. And now we have to understand what we need from the medical science, and then you should understand what you are going to develop, how you are going to develop. Because the medical doctors are not engineers, and they don't understand the machine learning, they don't understand the coding and the software and all that. So if any doctor, they are going to talk about the artificial intelligence, so they may not have anything to understand it. You are going to develop this, how the images are processed, machine learning, and then how we are going to make the machine learning, and then your tools to be developed, and then police is going to help you. So at this moment, what medical science wants and what are the gaps that engineering people should understand it, and then probably engineering, from the engineering side, you are going to provide the solution. So I hope this is the time now that at this moment we have tied up with the IIT Bhubaneswar, then we are working on the artificial intelligence now and we are sitting together and developing many, research papers and also doing research in many domains, in various fields. So always, if anyone from your side or from the department, then probably School of Computer Science, computer applications, so they are interested, we can also jointly do this, research in AI, machine learning. So always welcome. We are meant for that.
Thank you, sir. Thank you very much. So I'll be in contact with you. So if the other questions are, definitely I'll take the questions in front of you, and I'll be in close contact to take this initiative further. Thank you very much, sir, for joining.
Thank you. Thank you. It's my pleasure. Thank you.
Now next session will be at 12 p.m. Fine. Thank you.